Wendy Rutledge with the Palm Beach Civic Association. Every afternoon at 3 o'clock during this coronavirus outbreak, the town of Palm Beach is offering a community briefing to keep us all up to date about the very latest with COVID-19. Today's was a very important meeting. It was moderated by Council President Pro Tem Maggie Zeidman. And the featured speaker was Dr. David Dodson, who is a leading infectious disease expert. In case you missed it, we recorded it, and you can listen to it right now.
I would like to thank Council President Pro Tem Maggie Zeidman for joining us, along with infectious disease specialist Dr. David Dodson. Their goal is to provide some clarity on the COVID-19 related issues. As we all know, there is so much information regarding this pandemic that it can be difficult to know what is accurate and what we should do to stay safe. Maggie and Dr. Dodson are here today to help us sift through the common questions and provide clarification on everything from how the virus is transmitted to what to do if you get sick. For those of you who don't know, President Pro Tem Zeidman, who also chairs our Public Safety Committee, was the Director of Nursing at Lenox Hospital in New York City. She is well known professionally for her expertise in the field of cardiovascular nursing. Maggie's daughter and son-in-law are both doctors in Boston who are dealing daily with the crisis in their hospitals. We are grateful for them, Maggie. Also with us is Dr. David Dodson, who is a renowned infectious disease specialist in our area and resident and has been practicing for over 35 years. He has very graciously agreed to help us educate our residents on this complex topic. Maggie, I'm going to turn it over to you now.
Thank you, Kirk. And Kirk, I want to thank you and Carolyn because these 3 p.m. updates, I called a few of my friends to make sure they were keyed into this one. They said they listen to all of your updates. This is really the lifeline to the community, to the information that you both provide every day. They look forward to hearing your steady, firm voice and give clarification on what we're supposed to do, not supposed to do. So it's really working very well, and I thank you. I know it takes time to prepare for these updates, but thank you very much, and thank you to you, Carolyn. Okay. Dr. Dodson, here we are again.
Hey, Maggie.
So we did Zika a few years ago,
right.
And 5 weeks ago, you and I got together, and we, way before things got to where they are now, we did a film for, thankfully, the Civic Association went along with us. And the reason that we did that film was to try to help people ahead of time to not get this virus. So I really want to thank you. You're part of our community. You're a very well-known and highly regarded doctor here, but you're also a specialist in infectious diseases. And I know you lecture all over, and we're very, very pleased to have you with us today.
Well, thank you, Maggie. I appreciate being here. And you said 5 weeks. It seems like 5 months.
I know, it does. And it's like it changes so quickly. So I'm the questioner. I'm Carolyn today. I'm going to ask questions, and Dr. Dodson will provide the expert answers. So, Dr. Dodson, let's start with the basics. Can you give our listeners a brief overview of the coronavirus and how it is transmitted?
Yes. So when we get new infectious diseases over the years in the world, most of them are what are called zoonoses. They start in animals. And so we've gotten, I guess, into a bad pattern here of getting a coronavirus every 10 years or so. So in 2002, 2003, we saw SARS, which is a coronavirus. In 2011, we saw MERS, which is another coronavirus. And here it is, 2020, and we have this disease. So,
can I just ask that you both move a little closer to the microphone? Thank you.
Yep. Mm-hmm. So it looks like every 10 years we're getting a new coronavirus. So this one started, it's believed to have started in a animal market in China, in Wuhan. The RNA of the virus most closely relates to a strain that's found in bats. So it may have started in bats, and some unfortunate guy made the unfortunate decision of killing and eating a bat at some point. That may have been the start of all this. It spread quickly. We've learned that it is very contagious, and we're just working out how contagious it is. From that was in November. In December, the Chinese first noticed a series of new pneumonia. They didn't know what it was, but they quickly found the agent. They sequenced the RNA, and pretty soon they had a test, and they began some very draconian procedures to limit the spread, which we in a democratic society can't necessarily do. But their handling of it by identifying cases, by limiting cases, each curve will go up and it'll peak and it'll go down, and they're on the downslope at this point. So this virus, along with others like Ebola and Zika and everything else, they each have a life of their own as far as epidemics go. So this one is a particularly bad one. We're seeing it worldwide. We've gone from basically nothing in November to 1 million cases worldwide now, and it's just phenomenal.
Do you, further down, there's this question, but I think it's appropriate to ask it right now. What's the projection on how this virus will respond? When will is it expected to peak? When will it level off? I know there are different models, but what do you go by?
Well, there's a lot of modeling projections that are made, and they're based on various hypotheses. The only firm numbers you have is deaths. That is an irrefutable fact. So, and there have been some back estimates that for every death, there's X number of cases. And the thing, all these numbers have to be taken with a grain of salt because the numbers are based on testing, and if there's no testing, there's no number. So that's been the problem here. And so some people have estimated for every test that's been present in the United States, there may be 10 cases that are untested, but there. Mm-hmm. So what we see is when people are infected, the incubation period is 2 to 14 days. Average about 5 days, they develop symptoms. And then within a week or two, they'll become really symptomatic or they'll start to get better. So, and then as this goes on, the people who end up really getting sick end up in the hospitals, and then after that, the mortality curve starts. So you have an epidemic curve, and then later on you have a mortality curve that follows. So the higher the apex of the epidemic curve, the more mortality you're going to see after that, usually 2, 3, 4 weeks.
Well, there's been a lot of anxiety generated by the article on aerosols there. And as you and I both know, that article was published in the New England Journal of Medicine and Lancet, and it referred to a lab experiment. This is something people have a lot of angst about here. But it was conducted under specific parameters, which looked at how long the coronavirus stayed in the air. Can you comment on whether this study can be applied to the outside air here in our town? Let's say I take a walk on the lake trail and someone sneezes. Can I get the virus by breathing in the air if I'm walking after they have already been there?
Right. I think it's helpful to keep in mind the structure of this virus. It's simply some RNA in a lipid envelope, and it has these little protein spikes that go through this envelope. And that's why when you look at it under an electron microscope, there's a corona from these spikes. That's why it's called the coronavirus. And it's really a very fragile little virus. It can be killed easily by ultraviolet light, by soap, by any of the common disinfectants. And if it's on a surface, it'll naturally degrade with time. So it's helpful to keep in mind that it is, in fact, a fragile virus. Now, so most people believe that the main transmission is by droplets. That is, the viruses and respiratory secretions, they're coughed out. They can go up to 6 feet. That's where the 6 feet comes from. And then it may live on surfaces for a period of time. This new, the letter in Lancet, in the British Medical Journal, I think, it showed that under certain conditions, the virus could remain aerosolized for a longer period of time. But when you apply that to the real world, you'd have to postulate that somebody was actively coughing and sick. They spewed their virus into the air. It happened to stay for a little while longer than we otherwise might expect, and you happen to have shown up right at that exact moment and breathed it in. And that sequence of events is probably pretty remote. And plus the virus in the meantime is exposed to ultraviolet light. So the risk of aerosolization is maybe theoretically possible, but probably not practical. The question is, there are some viruses that are airborne, like tuberculosis and chickenpox. They are minute particles, and they can stay in the air for a long, long time. That's typical airborne transmission. But that doesn't seem to be the case with this particular virus. If COVID were an airborne agent, the numbers that we're looking at, they would be 10 times greater right now.
So that's why the World Health Organization hasn't labeled it as airborne.
That's correct.
Yeah, I wondered. Thank you for clarifying that. That was very good. So as you mentioned, the virus can remain on surfaces for some time. And according to the New England Journal of Medicine, I don't bring that up just because Jess and Josh are, at Mass General. But
why not?
It lives on glass for 96 hours, on plastic for 72, stainless steel for 48, and cardboard for 24, and copper 4. So what should we may be having groceries, I hope we're having groceries delivered, but if we're bringing groceries into the house or having them delivered or taking takeout food, what are some of the things that we can do to prevent? You mentioned that it's very unstable. So
right.
Could you address that?
Yeah, so again, that was under certain laboratory conditions. So those are kind of optimal conditions for the virus to survive as opposed to real-world conditions. So let's say you get a package from UPS, and let's say the person at Amazon coughed on it just before it left, or the driver of the UPS truck coughed on it and left it at your doorstep. So from that data, the virus may last for about 24 hours on cardboard. So one thing you could do is when you get a package, just put it in your garage for a day and just leave it alone. And chances are the virus will degrade. The other thing you could do is spray some Clorox on it. That'll kill the virus, or keep it out in the sun. And then when you open the package, you could just open the package, take out whatever's in it, and leave the box out and throw it in the garbage. Don't let it in your house. So simple things like that, which is probably a little bit on the overkill side, but it's better to be safe than sorry. So, as we go through and we hear all these things, just keep in mind the fragility of the virus. Okay,
thank you. There's a video, too, if anyone wants to watch it. I'm sure you've seen it. Dr. Van Wingen on, yes, you have, on YouTube. And he shows you how to bring your groceries in. He creates an aseptic space, and then a dirty and a clean space. And so if anyone wants to watch that, you can watch it. So let's talk about the symptoms. There's a wider range now. So, what do you notice maybe as the first symptom? Could you go over that with us, the symptom
Sure.
explosion?
Yeah. So we'll talk about symptoms in just a second, but basically what we're learning is there's kind of a spectrum of disease. So what happens when you get infected with the coronavirus? Well, there's basically 5 things that can happen. The first thing is that you get infected and you remain entirely asymptomatic, and we'll talk about that. The second thing is you get a mild disease, like a flu-like illness. The third thing is you get severe disease that maybe you end up in the hospital and then you get better. The fourth thing is critical disease, where you end up on a ventilator. And the fifth possible outcome is you die. So fortunately, the die part is a very, very small percentage of all the cases, of all the coronavirus cases. So if you look at what happens most of the time, 80% of the time, if you get infected, and we don't know the asymptomatic numbers, but if you get infected and are symptomatic, 80% of the time you're going to have a flu-like illness, pretty bad, you'll feel lousy, and then you get better. And the next group of people, they start not to get better, they start having more cough, more shortness of breath, and then that's the group that ends up in the emergency room or the hospital. And then they'll be closely monitored, their oxygen levels, their x-rays, their labs, and everything. And most of those will go home. And then the critical group will end up on a ventilator. And unfortunately, if you end up in the ventilator, you got about a 50-50 chance of surviving. That seems to be the numbers we're seeing. And that's partly because the people who end up in ventilators have pre-existing conditions, heart disease, lung disease, immune problems, other things like that.
Maybe this is a time then to go ahead and talk about what are the other symptoms that people might have.
Yep, so when people are infected with coronavirus, 96% have fever, about 80% have a cough, 65 something percent goes on and develops shortness of breath. And then people feel achy and they feel fatigued. Those are the top 5 symptoms. There have been a subset that have developed some GI symptoms like diarrhea. And a very interesting symptom is the loss of sense of smell. I had a patient recently who had a febrile illness and he was coughing and everything. He got the test and he was positive. And then he stayed at home, and then he eventually got better. And what he noted was that about the time he got the test, when he was really sick, he had lost his sense of smell. And he spontaneously, before, he hadn't heard about the British report, but he mentioned that I've just lost my sense of smell. And then I talked to him the other day, and he's now almost recovered, and he says, I got my smell back. So that's a very interesting little thing. And the British report said that if you just out of the blue lose your sense of smell, that possibly could be a harbinger of disease, and maybe you should think about getting tested or getting isolated.
Yeah, that has come up just recently, so I'm glad. What about a runny nose? Would that be?
That's not. I mean,
not
it's possible.
typical.
I mean, this is a virus that attacks your respiratory system, starting with your nose, your nasopharynx, your throat, your bronchi, and your lungs. So that's what it attacks. So certainly you could have a runny nose, but that's not a clinically defining symptom.
Mm-hmm. Okay. This is especially important when we were talking about the asymptomatic, people who are asymptomatic. And I had recently heard that up to 25% might be asymptomatic or might have such mild disease that they don't even recognize it. And this came up for us recently with younger people who they feel fine, so they kept being together. And then the transmission just skyrocketed. And I tried to make it very clear that when you're young and you don't feel anything, you've got to be very careful. You got to assume that you're COVID positive because you may go around your parents, you may go around your grandparents, want to hug them, want to visit them, and they are the vulnerable group, age 65 and older. So I know that recently that's come up about masks. That maybe if you should, assuming that you're COVID positive, if you wear a mask, it may prevent transmission to others. Could you comment on that?
Yeah, so the asymptomatic part, that's a very interesting and possibly scary part of this. There was one study in China that showed that about actually 10% of their coronavirus cases were asymptomatic. In the United States, we have no eyes on that. We have no idea because almost by definition, to get tested in the United States, you have to have a fever and a cough. You have to have symptoms. So it's impossible to know how many asymptomatic people there are in the United States. So, just step back from an epidemiologic standpoint, the way you control an epidemic is you test everybody. And then you know who has it, then you know who doesn't, and you keep those two groups apart. So because of the limitations of our testing, we've never been able to do that, and we've been running from behind with one hand tied behind our back. So once tests are more available, and they are becoming more available now, we're getting more and more tests available in our office, in the hospital. More different companies are coming online. So eventually, I think everybody should be tested, period. And then we'll start to have a handle on who are asymptomatic and who are not. And then there's a blood test that'll be able to tell whether you have antibodies for coronavirus. That'll be helpful epidemiologically. It won't be helpful in the clinical management of a particular patient. So wider testing would be helpful. As far as the masks are sort of, okay, so some people may be asymptomatic. And again, we don't know how the asymptomatic people, how long they shed it, how much they shed it, or what. But so you combine that with this new possibly airborne thing. So it might not be unreasonable for everybody to wear a mask. If you look at all the films coming out of China and South Korea, they all have masks. Mm-hmm. So that may not be unreasonable, but we don't have any hard data there.
I think we're going to be seeing a lot of masks around Palm Beach. What about gloves?
Well, the same thing. So the way it's transmitted is by either inhaling these infected aerosolized droplets, or the droplets end up on some surface, and then if you touch that surface and then bring it up to your face, your mouth, your nose, that's how you inoculate yourself. The virus will not go through intact skin, so it has to go through some sort of mucous membrane. And that's what you did. So that may be another reason to wear a mask, is it just may remind you not to touch your face.
Yes, that's a very good reminder. I think we were all trying not to do that. I think we've come a long way.
It's really hard, though.
It's very hard. You get a little itch. Yep. I know. It is. Just a word of caution about the fevers, since that's a really defining characteristic of symptom, is that we're looking at fevers not on pain fever reducers. I mean, if you take a fever reducer like Tylenol, you're not going to have a fever. So it's always important. I just want to make sure that our audience understands if you're taking a fever reducer, you may have a normal temperature. So so we just have to think about that.
Well, step back.
Yes, go ahead.
Throughout history, fever has been a cardinal sign of an infection. And the fever is your body's way of fighting off that infection. So when you just drop a fever with a medicine per se, you're not necessarily doing anything for yourself in terms of fighting that infection. So if you're uncomfortable with the fever, sure, take a fever reducer. But if you're not, let your body fight off the infection.
At about what temperature would you say you should take it?
Well, it's more has to do with your discomfort rather than the actual number. And then we also should talk about Tylenol and Advil. So there was a case report in I think it was a British Medical Journal, of one clinician had seen that 2 young people had taken Advil, and then their cases had gotten much worse, and so he postulated that by taking Advil or ibuprofen, that might make SARS worse. That doesn't seem to be panning out. WHO still recommends taking it because of the somewhat the controversy of this point. In the United States, they generally recommend taking Tylenol, but if you're otherwise taking Advil or ibuprofen, they don't recommend stopping it either. So take if you're uncomfortable with your fever, take something, probably Tylenol, but Advil or Aleve is okay too.
I think you made an excellent point about the body's reaction to an infection. And the fever is your body's reacting to it and trying to take care of it. So you don't necessarily always want to undo that. In the hospital, we don't generally give anything to reduce a fever until it's 100.4. Yeah,
right.
So that's something for everybody to think about. Another symptom that gets listed, Dr. Dodson, that I think is hard for people to understand is shortness of breath. What would you describe that as? What should people look for? Shortness of breath. Okay.
So one thing we're telling all our patients, if they're worried about what to do if they contract coronavirus, is to go out and get a pulse oximeter. If you have that at home, that gives you an objective measurement of the oxygen in your blood. It's a little thing that the nurse puts on your finger when you go to the doctor's office. It measures your pulse and it measures your oxygen level. So having that, when I'm managing a patient with coronavirus at home, having a pulse oximeter is a very useful adjunct to have, because that gives me a little more eye on what's going on in their body. So
I just ordered one.
Well, you're very prescient.
And
yes.
the normal is 98%, 99, 97?
Well, above 90% is fine.
Okay, so above 90% is fine.
So let's talk about what happens with a severe case of coronavirus. So as we said, 80% of people will be fine, they'll get over it. Some will not. They'll get so short of breath, they'll be coughing so bad, they'll be feeling so bad that they have to go to the hospital. So what's going on is the coronavirus enters through your respiratory tract, and then there are certain receptors in your lung that the coronavirus binds to, and then that sets off, there's a mechanism using T lymphocytes that sets off, the primary problem with the coronavirus is inflammation. It sets off a huge inflammatory response in your lungs. It's called the cytokine storm. There's all these inflammatory markers that just go nuts, and your lungs then get inflamed, and part of the response of lung tissue to the inflammation is to pump out fluid. And so then you can get fluid in your lungs, and then in the worst cases, that's called ARDS, adult respiratory stress syndrome. And what happens basically is you're drowning. You're drowning in your lungs are drowning. And so the sense is that you just can't get a breath. You can't get enough oxygen to your body. And then when that starts happening, that puts a strain on your heart, on your lungs, or on your kidneys, on all your other systems. And that sets off a whole cascade, and that's why people who have these diseases do worse.
Mm-hmm. Thank you. That was a very good but vivid, and I'm glad that you did make it vivid, because you simply can't oxygenate lungs if you get to that point. The oxygen exchange will not occur.
That's right.
It just will not. Can you give us an idea of the typical course of the COVID-19 of the infection itself? You get exposed to it. When would you might see your first symptom? When would you have to be concerned about, now here will be the real lung involvement?
Yeah, so a typical kind of course is you get inoculated with the coronavirus. The incubation period still appears to be between 2 and 14 days, on average 5 or 6 days before you develop symptoms. And again, that's if you're going to develop symptoms. So you get inoculated, maybe about 5 days later, you start to feel achy and have a fever and have a little cough, and then these symptoms gradually amplify. What happens in each individual case is there'll be a crescendo and then a decrescendo. So the symptoms will get worse, reach a peak, and then you'll start to get better. So how bad those symptoms are, I can't predict in any one case, but in, like I said, 80% of cases, you'll feel terrible, and then you'll start to feel better, and then you're on the downslope, and then you're okay. So then when people get in the hospital, the symptoms are very bad. And so, again, what we do in the hospital is we give them oxygen. We monitor their vital signs. There's some lab parameters, like particularly the CRP test. That seems to be very predictive of who's going to do well and who isn't. If the CRP is sky high, that's a bad sign. And then there's something called IL-6. It's an interleukin. We can't measure that clinically, but that level goes way up in a coronavirus infection. So that's another parameter that we can follow. So we follow these symptoms, and then in the treatment in the hospital, most of it's supportive, because we don't have any treatments that we work. We can talk about treatments or potential treatments in a minute. So then we support them, and then most of those people go home, and then a fraction of them will get so bad that they're on the ventilator, and then what happens.
Right. You either make it or you don't at that point. Yeah. Okay, so this is allergy season right now. How would you how can we distinguish the difference between an allergy and COVID-19 infection?
Yeah, well, fever is a number one. So an allergy, your nose starts running, you get a little sinus congestion, you get a postnasal drip, maybe a little bit of cough, and that's about it. Coronavirus, very different. You get a fever, you feel achy, and you have a cough that's far worse than any cough you've ever had with allergies, and then the other symptoms can develop.
Thank you for that clarification. So let's say so it's fever. That's really what makes the difference. Okay, let's go back to what do you do if you have symptoms? You call your doctor?
Yep.
Okay.
Yep. So,
and then what happens?
Okay, so let's say you do develop fever and a cough and some shortness of breath and some muscle aches. That's suspicious for coronavirus. In the best of all possible worlds, you get a test. And again, as time goes on, the testing is going to get easier. So when a patient calls me, now that we have more tests, I'll say, come on in, get a test. Or go to the ballpark or wherever it is. So a test, again, gives you eyes on exactly what's going on. And just keep in mind that if you get some symptoms, just because we have coronavirus in the world doesn't mean all the other respiratory pathogens have gone away. You could still get those too. It could still be something not coronavirus. And so, but if you get the test, then we kind of have some eyes on what's going on. Now, the one thing I am a little concerned about, I'm starting to hear reports about false negative coronavirus tests. Right. And that's an issue because what you have to do is the test is a little cotton swab, and they have to jam it up way up your nose. As one patient said, I thought they were getting my brain. But you have to get it way up your nose. You have to twist it. You have to get enough secretions on that swab. And then you take the swab, you put it in a viral media so it can survive, and then that has to go to the testing the lab, and then they have to pull it out and take some of that secretions and then test it. They do a PCR test to see for presence of the virus. So all of those steps have to work perfectly in order to get a positive test. So there is a possibility that some of these tests may be falsely negative, and I worry about that.
I read about that. Just another thing for us to be concerned about.
Yep.
Plus the 5 days before you have the symptoms that you're now shredding the virus, and
Right.
you've been around your family.
Yep.
So let's march on to that then. Let's say, all right, now I'm positive. I've been around my family. I'm doing okay. Oh, by the way, when someone comes into your office, you will have them wear a mask in your office. Is that what you recommend?
Well,
what do you do?
Actually, right now what we're doing is we're screening people over the phone. If they have any possibility of a febrile coughing illness, we try and manage it without having them come to a healthcare facility. So, and most COVID cases will be managed at home.
Mm-hmm.
So let's say you have the symptoms, you get the test, you're positive, then your doctor's going to talk you through it basically, and we're installing telemedicine things on our computers right now, but most cases we'll manage at home, and you'll feel awful for a while, and then you'll get better. And
what about the people that you have been in contact with prior to even having the symptoms? Now,
okay. So that's the problem. So we don't know exactly. We assume that you could be transmitting the virus a few days. Let's say the average you get coronavirus. 5 days later, you get the symptoms. You're probably contagious for 2 or 3 days before you get the symptoms, and then certainly after you get the symptoms. So if you've been in contact with your family, they need to be quarantined for 14 days, just to make sure that they don't get symptoms. But again, as testing becomes available, they can wait a little bit and get tested, and that would give them another level of reassurance other than waiting the 14 days.
But right now, because we don't have enough tests, we recommend that they they're quarantined for 14 days.
Yeah, because most symptoms seem to develop within 14 days from exposure. So if you make that 14 days and you don't get any symptoms, you're probably fine. Mm-hmm. But again, we don't know about asymptomatic carriers and that sort of thing.
There are interim guidelines on the CDC website if you are caring for someone at home that are very good, that talk about how you clean. Do you do laundry, how you clean the room, bathroom. People have to be isolated into their own room and have their own bathroom. You can't share utensils. So there's very specific instructions on the CDC website if you should get into this situation. Now, does the health department do a follow-up, an epidemiologic follow-up on positive patients?
Well, the health department, God bless them, has been a little overwhelmed, but all positive tests from the labs go to the health department. So sooner or later, if you're positive, you may get a phone call from the health department. But the contact tracing sort of part of it is they're doing what they can do to get everybody tested, first of all. So the other part will probably follow.
So should you then, if you have a positive test, or you know that you have been exposed to someone who has now called you and said, well, I was positive, but now I know I have been around my family, you all really you should let people know, obviously, that you tested positive. And how far do you take that? Letting people know that you have been around someone who was COVID positive? What do you say about that?
Yes. So if you or your family member gets it, and you've recently been in contact with somebody, it's the right thing to do to inform them. That's, it may be a little difficult, but you have to give them at least the knowledge of the fact that they've possibly been exposed so that they can take measures to protect themselves.
Yes, that's right. And so I just wanted to make that very clear. When should somebody call 911?
Okay, so So you have coronavirus at home, your fever is going, you're coughing, you're getting short of breath. And again, this is where the pulse oximeter is a useful piece of information. If you're getting readings in the 80s or 70s, your oxygenation level is poor. Generally, it's when people just start feeling like they just can't breathe. Then that's the 911 trigger. And when you do call 911, it's the right thing to do to inform the EMS people that you have a coronavirus case, that you may be a coronavirus case, so that they can take the proper, well, they are anyway, but they'll take the proper protections to get you safely to the hospital. And when you arrive at the hospital, they in turn will inform the ER that we have a possible COVID case, and so the ER can be ready to do what they're going to do.
Chief Donato and Sean Baker have done a great job. They have a whole list of questions that when someone calls, and they'll ask them, are you coughing? They go through a whole list, so they know
Sure. before
they go whether they need to have all the PPE, the personal protection equipment, on, and they've been very good about it. Let's see. Yes, go ahead.
Yeah, Maggie, you remember in the AIDS epidemic?
Yes, very well.
Yeah, so back then we didn't have a test early on. It was a similar thing, and we didn't know who might have it and who might not. So that's where universal precautions were born. Mm-hmm. So, and then basically it's the assumption that kind of everybody has it. So when an EMS or somebody comes up to a patient, kind of assume it might be, even if they're not the classic symptoms.
We're going to need a lot more PPE, Kirk. Okay. There's been a lot of angst about the testing. Recently, the criteria have been expanded. So let's go over the new criteria. Who can get tested?
Well, again, everybody should get tested. I want to be very clear about that. Every person should get tested. The only reason we're having this conversation is because we don't have enough tests that have been made available to our population. So right now, because of the testing limitation, we're limiting it to people who are sick, who are symptomatic. And when you call up to get tested, and by the way, the number to get tested in Palm Beach County is 561-642-1000. You're going to get a series of questions, and they're going to look for a temperature of over 100.5. They're going to look for cough and shortness of breath and muscle aches and that sort of thing. So if those symptoms are there, then they'll say, come on over, and they'll give you a number and you'll show up at the right time. But really, if you have any symptom whatsoever, you should be tested. If we, in the best of all possible worlds, why not?
Mm-hmm. So talking about testing then, what do you see on the horizon that will happen here that's going to change that?
Well, what's happening, just starting to happen right now, is wider testing. That really gives you a window into what's actually happening. So what's going to happen in Florida is we're already on the upslope of the curve, but as wider testing occurs, the numbers are going to get even higher because the cases are out there already. We just haven't tested them yet. So we're going to get more and more. So what's going to happen over the next few months is we'll get a handle on how many cases we have, and then again, some of those cases, some of them will be asymptomatic, some of them will be symptomatic, and then a few of them will go on to hospitalization, and then that's where the crunch is going to be, depending on how high that number is in relation to the capacity of the hospitals. That's where the crunch is going to be. So that's, if a lot of people end up in the hospital and on ventilators, that's what Governor Cuomo is on the TV every day worrying about.
So let's talk about that flattening of the curve so that we don't wind up we don't get beyond our own capacity. Tell us what you know about that for our particular county or the state of Florida.
Yep. So, I think there's two things to hold on to. Number one, if you stay in your house or home or apartment and you're not in contact with another infected human being, you will not get coronavirus, period, done. Number two is if you do, God forbid, 80% of the time you're going to have an illness and you'll be fine. So that's the kind of the optimal thing. So the best thing, in order, again, the curve is just the number of cases. So the best thing we can do, both for ourselves and for our society, is not become a case. So the way you do that, because we don't know exactly who has it and who doesn't, is we have to do these draconian measures of total social isolation, shut down all the restaurants, shut down the beaches, shut down everything, because that's the only way you can keep people apart. And once you do that, then the virus the new cases kind of stop in their tracks. And there's about a 2-week lag time between the time you institute a measure to you starting to see a difference in the curve. So we have to wait a little bit when we've instituted whatever changes we've done, and then hopefully that'll start to flatten out the curve.
We instituted changes here as of March 16th. Is that correct? Yeah. So go
yes,
ahead, Kirk.
well,
Would
we
you
started
comment on that?
informing the community, and you took a part in that information that we were passing out to the community, but we started taking some decisive government action on March 16th.
Yeah. We formulated it before that, like 4 or 5 days before that, 3 days before that. But
yes.
Yeah, so we were early on trying to understand what this virus could do and what actions our town manager wanted to know what actions he could take. So we were fairly aggressive and proactive because we have a very vulnerable population.
Well,
and we
sure.
saw what happened in Seattle in the nursing home. So.
Yeah, well, from an epidemiologic standpoint, not economic, epidemiologic standpoint, you can never go wrong doing too much. So it's better to go early and heavy because that blunts the later effects. Now, the other part of it is the economic effects, and obviously that's a problem. But from an epidemiologic standpoint, the earlier you intervene and do things, the better off you're going to be. And I'll just add one other thing. So on January 20th of this year, that was the day that South Korea and the United States saw their first case. In South Korea, they instituted testing, isolation, all the control measures, and their curve went up, and now it's definitely on the downslope. In contrast, in the United States, after our first case, we did not have the testing. We did not have the aggressive social isolation policies, and our curve is now still going up. Mm-hmm. And it's just a stark contrast in how two countries have handled this thing.
The medical community and others are very concerned about the lack of testing. But we do see progress toward more testing, thankfully.
Yes, thankfully.
Thankfully. It took a while. We were a little
took too
slow
long.
on the uptake.
It took too long.
On that.
Yep.
Okay. I won't belabor that because what has happened has happened. We can only hope that it is getting a lot better. Okay, here's a question that has come up. Say I'm positive and I've isolated at home for 14 days. When is it safe for me to be around my family? Is it at the end of the 14 days?
So you have coronavirus?
Yep, I have coronavirus, but
Okay.
I wasn't in the hospital, so I didn't
Yep.
get those 2 tests 24 hours apart. Yeah.
Yep, right. Okay, so, we don't know.
Okay.
Once a person is recovering from coronavirus, we don't know how long they're going to be able to shed the virus. So it would be helpful, like the CDC has proposed early on, they proposed a criteria for discontinuation of strict isolation stuff of 2 negative tests a day apart. So that's kind of gives you a little assurance that the person isn't still shedding virus. But still, the virus can be shed in stool. We don't know how long the virus can be shed after a person has clinically recovered. That is going to be, we'll find that out as time goes on, but we don't know that right now. So a rule of thumb is basically 3 weeks after symptoms begin.
Okay,
Ballpark.
That's very helpful for those who are going through this or who think they may be COVID positive but couldn't get a test because there were no tests available.
Right.
It's important for us to maintain this for 3 weeks and then continue. You can be around your family, but you better stay away from everybody else because that's the name of the game. Stay away from people.
That's it.
Right?
Yep.
Okay. If you could tell us anything to keep us and our loved ones safe, I called it the evildoer virus. What would you tell us? What do you want us to do?
Well, I look for lessons in things like this. One lesson is that Mother Earth is not very happy with the human beings, and so she's unleashed this on us. What we've learned is that, we all live on just one planet, one Earth, and we're all the same. Our DNA of all human beings is 99.9% exactly the same. And so we're all vulnerable to this. And so, it makes no sense to me if we're all exactly the same, why should we then be mean to one another? So one thing I'd say is and we also have to talk about our kids. Our kids are sitting here watching this whole thing. They're listening to the TV. Maybe we don't see what they're absorbing, but they're hearing it. And so we have to learn that we'll all get through this. Most of us will get through this. I'm sorry. And we have to learn how to. The lesson is that the best way to take care of yourself is to take care of others, because if you can take care of other people, then you're less likely to get sick. And that's exactly what's happening with this social isolation. So I guess my word would be keep up the social isolation. Don't become a case, because that puts a strain on everybody else and a risk to everybody else in our healthcare system. And be kind throughout this whole thing, because this is a test of our national character. Are we going to be scaredy wimps, or are we going to be strong and kind and generous? And that's a question that each of us we'll all have to answer.
I think after that, that's the message that we need to take away from today. And I thank you, Dr. Dodson. Is there anything else you would like to add that I didn't ask that you think should be?
Hydroxychloroquine.
Okay, yes, all right. Go ahead, tell us about it.
Yeah.
And azithromycin.
Yeah.
Mm-hmm.
Okay, so
go ahead.
we talked about treatments. There is no treatment that we know of that works against coronavirus. So there's been some treatments that have been thought of. So it's an inflammatory reaction. So the first thought was steroids. That may or may not be beneficial. We don't know. We're not using them particularly, except in certain cases. And then there are anti-inflammatory drugs like chloroquine and hydroxychloroquine. Those are used in rheumatoid arthritis and lupus to suppress the immune system. So the thought was, and they worked on this certain T-cell mechanism, so the thought was that maybe they could work against this coronavirus. So there's about 10 clinical trials going on right now about hydroxychloroquine. There was one study in France that showed the viral load went down when they used hydroxychloroquine. But again, I have to emphasize that we don't know that it works. In 2 or 3 or 4 weeks, we may have a better idea whether it works or not. And there are toxicities to the hydroxychloroquine. There are cardiac arrhythmias, there are retinopathy and blindness, there are a whole bunch of things. So a lot of people have called us and asked for hydroxychloroquine and azithromycin prescriptions. I try and caution them that really, if you're going to get it, okay, for your peace of mind, you can put it next to the toilet paper to make you feel a little better. But I wouldn't use it unless you're about to go to the hospital. Because again, most people will get through the illness fine without anything and without adding any toxic drugs. But if you're really starting to get sick, like if we don't have anything else to offer a patient in the hospital, we'll start it. Sure, there's a lot of hospitalized patients on hydroxychloroquine and azithromycin right now in Palm Beach County. So why not until we know whether it works or not? So I think that it's a reasonable thing to think about. But again, possible toxicities, and we don't know for sure that it works at this time. There's another drug called Actemra, which blocks IL-6 receptors. That's been thought about. There was an AIDS drug called Kaletra that they thought that might work. It doesn't. That one's fallen by the wayside. And then we're working on interferon type agents. And then the convalescent serum of people who have actually survived. You take their antibodies and you inject them back into coronavirus patients. Maybe that will help. We don't know. But those are the kind of things that are being thought about right now.
But we won't have an answer on that for some time.
Right. Clinical trials. The problem is when you give, if you have a disease where 80% of people are going to get better on their own, and you give them some whatever, then 80% are going to get better. So, and then you can say, oh, it's because of the drug. Well, not necessarily. Unless you have a control group, you don't know the answer to that.
Yep. Thank you for explaining that.
I have one more drug that I've been hearing about from the beginning, the malaria. I don't know the actual chemical name. Did you mention?
That's chloroquine.
Chloroquine.
Okay.
Yeah.
Yeah.
But to us layman people here, you have to forgive me.
So-
Well, the one other
Yeah.
thing is there is an antiviral called remdesivir,
Yes.
and that actually does seem to be the most promising of the whole group right now. But they're doing clinical trials, and we'll find out about that.
Okay.
Is that the last word?
I think so. I think that's the last word. Anything else, Kirk? Any other questions that you have?
I have no more questions, or unless you don't have anything more to add, I could wrap things up.
Okay, go ahead.
The doctor, you said that everyone needs to do their part in order for our country to be successful and keeping our citizens safe. Everyone needs to be responsible and do their part, and their part is just following the CDC guidelines, isolating and washing your hands and maintaining your own safety. And by doing that, you keep the other members of the community safe as well. I want to thank you both. This was incredibly helpful, I know, to me and to everyone that's listening. Very informative. Overused statement, but knowledge is power, and with this power, it'll help keep us safe. I thank you both.
Thank you.
We'll see you all on Monday.